Hey, what up guys, it's Matt. So today I just want to do this video. I'm kind of coming to a point now in the program where we are seriously looking towards the end, which is of course graduating the program and then of course passing our board exams. And yesterday, one of our instructors, who's also the academic director, he gave a really long speech about the importance of preparing properly for the board exams and how soon that preparation starts. Most respiratory programs kind of have two tracks. On one track they're teaching you how to be a competent, knowledgeable therapist. And the other track, they're training you really to pass that exam, because the degree itself is kind of useless if you're unable to pass the exam. So they're kind of doing two jobs at once throughout your learning or whatever. So he literally talked for like 40 minutes about the importance of studying now. I mean, and he decided that based on how things have kind of gone in the past for him, or he didn't introduce review type material as far as the NBRC exams go until the fourth semester. And so with my class, he decided to introduce that this semester, so my third semester. And so we've been getting assignments out of our review book. So it's the James Sills Respiratory Care Review book. And he also has already granted us access to Lindsay Jones online. Now, some of the other popular review stuff, Pershing's and Kettering and all those are all popular, but these are the two he uses. Mostly, I think Lindsay Jones is a lot of convenience, and it's just really good practice. Just the volume you can kind of get through. It's paid for by the fees we've already paid, so it's not like I have to pay a monthly subscription for Lindsay Jones. I get it for basically the next year. And then the James Sills book he really likes because they with the exact normal ranges that the NBRC uses. So there's no question about that. With all these other texts, you may have noticed at this point that maybe your mechanical ventilation book has different normal value ranges than like an assessment book or whatever. So this book uses the NBRC ranges, and it's also twice as thick as most of the Pershing books. So one thing he always promotes is that Pershing's half the thickness and it's half the information, and he said that's not to mean there are people who can't take that book and pass the exam, but that's why he uses it for us. So yeah, we're literally starting with this semester. We've been practicing. If you do or don't know this about the NBRC, so the first exam you have to pass is the therapist multiple choice exam. It's 160 questions. 140 of them are actually counted towards your score. 20 of them are test questions that are being vetted and don't actually count towards your total score. And the NBRC wants you to get a 67% to pass at the high cut. So the way it's always been put to us is, can you get a D on this exam and pass at that high cut? I believe that's 94 questions. Passing with at least 88 questions right nets you into the low cut. So like 88 to 93 is basically low cut passing. 94 and greater is high cut passing. Below 88 is a fail. So our goal, of course, is to pass at least a 94 or greater, and that's what's going to allow you to sit for your clinical simulation exams. I don't know exactly the point values for the thresholds for passing or whatever with that, but perhaps I'll talk about clinical sims maybe later on. But for now, it's just about, I guess the point of the video is, when should you start studying? I do believe there is a point that is too early to start studying. So like if you're in your first month or your first semester of respiratory therapy school, you probably shouldn't worry about studying material. You don't have enough baseline rudimentary knowledge to begin studying. But honestly, by the end of that second semester, and maybe like if you do a summer rotation or something, depending on how your program's set up, by the time you're starting your third semester, your critical care rotation, if you've had some exposure in clinical to critical care, it is absolutely a good time to start studying. Does that mean you're going to know everything? Like, no, of course not. I mean, at this point, we are just starting my hemodynamic module. And there's a lot of questions about hemodynamics. I'll be looking at like an analysis type question. It'll have a patient with a specific disease process, ventilator settings, blood gas values, and hemodynamic values, and then ask you what would you change on the ventilator. It may say something as, what would you decrease, or what would you change, or whatever. And looking at the vent settings, looking at the blood gas, I can usually tell, well, hey, that blood gas looks good. So obviously, if they're asking you to change something, that means one of those hemodynamic values, be it pulmonary capillary wedge pressure or a central venous pressure, something is out of range. And until you learn that, you may not be able to answer some of those questions. But you never know. You may have enough, exposure, maybe clinically, that maybe you'd happen to know that average pulmonary capillary wedge pressure is 8, but it's okay between like 5 and 16 or something. But if that's high, what would you do? How do you increase or decrease that? So if you have access to any of the study material through school, guys, the start of your second year, you should be studying. I'm lucky enough that I'm a really good test taker, and for whatever reason, a lot of this stuff has just stuck in my head. And as I've been going through some of these practice exams and practice questions, especially on Lindsey Jones, I've managed to actually pass a couple of times at the high cut. But I'm averaging right around 60%, so definitely need to step that up. And set your goals high. If you need at least a 94 correct questions to pass at the high cut so you can qualify to take your clinical sims, shoot for 100. That's what we were told our goal is supposed to be. I'm shooting to get as high as I possibly can. But yeah, it's not too early to start. But honestly, waiting too long to start is also detrimental. You don't want to graduate, be qualified to sit to take your TMC, and then spend 3 more months studying. Like, you shouldn't need that long to study after you've graduated to pass this exam. Now, if you go in and fail, like, it's not the end of the world, unless you like super bomb it or something, then it maybe is maybe something to think about. But if you barely pass by 1 or 2, just know to put in the time. But honestly, like, if you just take it really serious and you study from, that point now in that second semester or that third semester, your second year, and you really put in the time. If you've heard about nursing and you see nurses who are doing 100 questions a day to practice for their NCLEX, it's like, this exam is no different for us. It's that important. Like, if you have the ability to do 50 questions a day, even just 15 questions a day, keep exposing yourself and budget your time for it. You still have exams, you still have studying to do, you still have quizzes, but take the time. Be like, okay, I'm gonna do I'm gonna study for an hour, I'm gonna take a break, and then I'm gonna sit down, and maybe instead of studying that material for another hour, maybe you sit down and knock out 15, 20 practice questions, and budget maybe another hour for just that. Give yourself time to do the questions and then go back, and depending on whatever material you have, read the rationales for what I love, like Lindsey Jones. It has some bugs, but for the most part, I can knock out 15 questions. It gives you like 18 and a half minutes to do 15 questions. I can usually do it in about 8 to 10 minutes. And then I have plenty of time to go back and read each question again, read what I selected, read what the correct answer was, if I got it right or wrong, and the rationale, regardless of whether you got it right or wrong. And I read it all, and I make sure I budget my time to do that. Because, chugging these questions away isn't going to be any benefit if you're not reading the rationales. You need to have an explanation for why they're right or wrong. And it becomes even more important, again, when you move on to the clinical simulations, which really none of those are recall. That those are scenarios that they have a fairly linear path, but so depending on what you choose isn't going to necessarily change the overall direction of the flow. But some of the questions you need to select all that apply, and then you get to the next section, which may only have to pick one. And those are the real nerve-wracking ones, because you think you have the right one, you pick it, it says physician disagrees, and then it's like, oh, you start losing it, and then you start clicking all of them, and then you get a bunch of physician disagrees, and next thing you know, you totally like bomb out a single ClinSim. So start studying now. The NBRC is that important. Passing the TMC and the clinical sims should be your final goal, as it's been kind of beaten to us. CRTs are kind of going the wayside. I don't know for a fact. I've seen different people say different things about some places and some states may not even like credential you as a CRT. So even if you pass at that low cut, they're not going to give you a CRT, and you pass the I cut, they're not going to issue you a CRT. Supposedly, don't quote me on that, but I've read just multiple things. Your goal is to be registered. All of my second year cohorts, don't sleep on it. Ask your instructors what you should be doing to prep, if they have any recommendations, and then trust your instructors, especially your classroom instructors. It's like part of their job, besides teaching you to be competent therapists, is to pass that exam, because 100% grad rate doesn't mean crap to a program if none of those students graduating can pass the NBRC. That does not look good on them. So they want you to pass that exam, and trust them, ask them questions, hit those office hours if you need them, and yeah, take it serious. So anyways, guys, I'm gonna stop it there. Everyone, I hope you're all doing well. Passing your exam this semester is flying by. I can't believe it's just basically a little over a month until we finish this third semester, and then I'm moving on to my fourth. So everyone, good luck on any upcoming tests. Comment below, let me know what you think. If you have any questions about what I'm doing to study for the board exams, I'd be more than happy to answer those questions. Anyways, guys, take it easy and have a great day.